Hi, I'm Dr. Joice Varghese MJ, consultant orthopedic surgeon and sports injury specialist, Lourdes Hospital, Cochin. Today we will discuss about subacromial decompression. Subacromial decompression is something which some of us tend to overlook because most of the rotator cuff tear patients will have some sort of impingement, and these patients will benefit a lot from a well done subacromial decompression or acromioplasty. So whenever a patient with a rotator cuff tear comes to you, always clinically examine them to detect if there is any signs of impingement, and if it is there, always look into the MRI and try to diagnose impingement. There will be some signal changes on the undersurface of the acromion, or there may be some hooking of the acromion. All these things have to be corrected if you want to give the patient a satisfactory result. So subacromial decompression is something which is very important and should be taken seriously when you are doing a rotator cuff repair. Entering the subacromial space with the trocar is slightly tricky. So you'll have to go from the posterior portal, hugging onto the undersurface of the acromion into the subacromial space. And you can sway your trocar little medial lateral so that you can make some space in the subacromial space for viewing. And then once you have done this, you can come in with a small needle from the anterolateral aspect of the acromion. The first portal you make for entering the needle should be such that your needle or the instrument which you are passing should be parallel to the undersurface of the acromion. So it should be made little lateral to the anterolateral border of the acromion. If it is made too medial, just adjacent to the acromion, you may not be able to do a good acromioplasty. So you should make sure that your instrument which is coming to do a subacromial decompression is coming parallel to the undersurface of the acromion. So first you come in with a radio frequency device for ablating, and what you have to do is you have to identify the anterolateral border of the acromion. That is where most of the impingement and the acromial spurs will happen. So first, with the help of a radio frequency ablator, you can delineate the anterior and the lateral border of the acromion. And regarding the coracoacromial ligament, sometimes some of us tend to release the coracoacromial ligament, but it is not always mandatory. Especially if there is a rotator cuff tear, it is always better to preserve the coracoacromial ligament. And about doing a subacromial decompression with a shaver is a little bit risky because of the bleeding which it can cause, and also it can cause injury to the cuff. So whenever you are coming into the shaver, make sure you can visualize the shaver clearly before starting the shaving, and keep your tip of the shaver away from the cuff. And once you have delineated the anterolateral aspect of the acromion, you can clearly visualize the hook of the acromion there, and so you can also see the normal level of the acromion on the medial aspect, and you can see how much there is a projection on the anterolateral tip of the acromion. So if the patient has a good symptoms of impingement, and on arthroscopy you are seeing that there is a hump on the tip of the acromion anterolaterally, you will have to do a acromioplasty. So you can easily do it with the help of a burr, but when you are introducing a burr, make sure that you are doing it gently, otherwise you might take out more of the acromion than what is required. So always be gentle, and if the quality of the bone is poor or if the bone is softer, then it is better to go with the burr in the reverse direction so that it won't take more bone. So acromioplasty is something to be done very gently, layer by layer, so that you are not taking too much of the acromion. If you take too much of the acromion, there is more chance that the humerus is proximally migrated, and that can also affect your abduction after your rotator cuff surgery. So doing a proper acromioplasty is very important in giving your patients a good result after your rotator cuff surgery. So make sure that you are not overlooking a subacromial decompression or acromioplasty when you are doing a rotator cuff tear. It should be done with a proper care and proper preoperative planning. Thank you.